Some of the men lived long enough to tell their story. Most did not. In 1932, 600 black men in rural Alabama were enrolled in what they were told was a medical program to treat syphilis. Many were poor. Many had little formal education. They trusted what they were told. However, the doctors weren't there to treat the disease. They were there to observe its progression. The doctors had a different name for this medical program, a study which they described as the natural history of untreated syphilis. Their aim was not to cure it, but to observe it from beginning to end. Some of the men already had the disease, others did not. Those without it were used as controls. Together, they were observed, not for treatment, but for research. At its inception in 1932, the study's architect was a senior official in the US Public Health Service named Taliaferro Clark. He envisioned a short study, only 6 to 8 months. But he was promoted and wasn't in control for long. Responsibility for the study was taken up by others at the institution, most notably Raymond Vonderlehr. He expanded it into an institutional-wide study and helped sustain it for decades. Internal reports described the project as a unique opportunity, an opportunity to observe a disease from beginning to end. They worked alongside local institutions, including the Tuskegee Institute, which was a black land-grant university created to educate black people. To the study participants, these doctors and researchers were not strangers. They were officials, experts, people to be trusted. When a man came in for what he believed was treatment, the process was calm, routine. He would be examined, his symptoms noted, questions asked in simple terms. Blood might be drawn. Sometimes he was given tonics or pills or injections of what appeared to be medicine. There were days when men were told they were receiving special treatment. In reality, they often were not. One of the most feared procedures was the spinal tap, where a long needle is inserted between the vertebrae to extract cerebrospinal fluid. Doctors described it as necessary, even beneficial. The men were told it was part of their care. In truth, it was used to study the progression of the disease within the men's brains. When the visit ended, they were sent home, reassured, told to return again. But over time, some of the men began to change. One man returned again and again, complaining of pain in his legs. Another began to lose his balance, then his memory. Some developed blurred vision, others confusion, and still they were told they were being treated. One of those men was Herman Shaw. He was young when he entered the study. Like the others, he trusted what he was told, that he had bad blood, that he would be cared for, that the doctors would help him. And for years, he believed them. But Herman Shaw's story is not the whole story. Because for every man who survived, there were others who didn't. Men whose names were recorded, but whose lives were not. Men who appear in records, but nowhere else. The doctors recorded how many men died, what happened to their bodies, the progression of the disease. But who they were was ignored. Their humanity was reduced to notes in a file. Even after penicillin became widely available, even after it was known to cure the disease, the study continued year after year. In internal communications, the objective was clear. The study will continue until all participants have died. The men's symptoms, their decline, their cause of death. To the doctors and the institutions, it was data. just information to be analysed. Years later, families would try to describe what happened inside their homes. Wives spoke of men who slowly became weaker, more distant, confused. One remembered her husband sitting in silence for hours, unable to follow a conversation he once led easily. Another described how he began forgetting familiar names, then places, then entire conversations. Some men lost their sight, others their coordination. Children remembered fathers who changed over time, not suddenly, but gradually, as if something inside them was being taken away. For some, the disease moved slowly. For others, it did not. There were men who could no longer work, men who struggled to walk without assistance, men who became dependent on the very people who once depended on them. Their wives and children struggled to understand what was happening to their husband, their father. And through it all, the men continued to return to the same place, trusting the same people. In 1997, decades after the study ended, the United States government issued an apology. Of the 600 men who entered the study, only 8 were still alive. Herman Shaw was one of them. He stood in the White House as Bill Clinton acknowledged what had been done. He was seen. He was heard. He could stand in a room decades later, shoulder to shoulder with the president, and be recognized. The others remained where they had been left, in files, in numbers, in silence. The most disturbing part of this story is the intent. No attempts were made to hide it. It was written in official documents, recorded, justified. 40 years passed until the study concluded. All the while, the men's disease progressed and their families' pain intensified. The treatment had been readily available for 27 of those 40 years, but it was not given. But what of the men who designed the study? Who continued it for decades? Who withheld the medicine to treat the disease as they watched their patients wither, suffer, and finally die? They were already gone. No trial, no sentence, no verdict, only records, only data, only outcomes. And one question remains. How many of the Tuskegee men went to their deaths believing that good people were trying to save them?